As Tracy mentioned, the president's receiving a steroid that's typically reserved for the most critically ill COVID-19 patients.
So how does this medication work? We spoke to doctors about the treatment. Channel 2's Brittany Jeffers joins us live from the Texas Medical Center with what she's learned about dexamethasone. Brittany, good morning.
And good morning. Doctors are telling us that this particular steroid therapy helps by reducing inflammation in and around the lungs. President Donald Trump on the move over the weekend and said to be improving, but questions about his health remain. Well, the White House physician says the president had at least 2 episodes of low oxygen levels and was given a steroid called dexamethasone. An NBC correspondent offered some insight as to why that would be concerning.
The fact that he was on oxygen, went off of it, then his oxygen level dropped again for a short time gets concerning because that means it's affecting his lungs. And if that continues and gets worse, it could be dangerous.
The steroid use is becoming wide in the treatment, especially in patients who are critically ill with COVID or who require ventilation or high-flow oxygen.
Dr. Hana El-Salih at the Baylor College of Medicine tells us that the steroid therapy works by reducing inflammation in and around the lungs. It's usually used in severe COVID cases, though recently it's also been used in less severe situations. Even still, President Trump tried assuring the country he was on the mend, offering this message before briefly leaving the hospital to salute his motorcade of supporters who'd gathered outside.
So it's been a very interesting journey. I learned a lot about COVID. I learned it by really going to school. This is the real school. This isn't the let's read the book school. And I get it, and I understand it.
So, of course, the president will continue to be monitored very closely. But coming up in the next hour, I'm going to have some more information on this particular steroid therapy and some of the risks that physicians say could be involved. Reporting live this morning in the Medical Center, I'm Brittany Jeffers, KPRC, Channel 2 News.
Well, thank you, Brittany.